There's a rule of thumb statistic that in hip and knee replacement, about 1 out of 3 patients who would benefit from the surgery actually has the surgery. That means 2 out of 3 people choose not to get the operation. The most common reason is fear. Fear of the unknown, fear of post-surgical pain, fear of bad outcomes they've heard through the grapevine, not having accurate information. I think that's the most common thing. I think the other common reason that people choose not to have surgery is that they sort of convince themselves that whatever limitations they have are limitations that they can learn to live with and accept. After all, I'm getting older. I shouldn't expect that I should be able to do all the things that I could do when I was 20 years younger. From my perspective, that's sort of missing the boat. As we're living older, we want patients to be more active. We want them to stay healthy, because the more active they are, the stronger they are, the more flexible their joints are, the less pain, the less arthritis, and the better overall quality of life they're going to have. I think patients are surprised about a lot of things these days after joint replacement. It's very different than it was 20 years ago. Number one, our pain control mechanisms are very different. And so I think patients are surprised by how good they feel immediately after the surgery and how much they can actually do in terms of the normal everyday activities very quickly after surgery. Within a few days, they can get to the bathroom by themselves, they can prepare meals for themselves, they can do most of their exercises on their own. The other thing that goes hand in hand with that is that because we're trying to get away from the use of narcotics, we've really developed a non-narcotic protocol for post-operative pain management. And I think people are surprised at how good that actually works if they follow it.